All right, so welcome again to our office hours in February. I'm Pam Valvano, as I said, contract manager for Telligen. Just a couple of reminders for today's session. If you are registered and others are listening with you, we would appreciate it if those that are not registered would go ahead and register for the session so that we know who attended. I'm going to put the registration link here in the chat, so it's there. You can click that link and go ahead and register for the session, even if you're listening with someone else. We appreciate it. Thank you. We're asking everybody to please stay muted through the presentation of information, and we will take questions and answers after each section. So please stay muted until then so that our recording is clear and we have everything that we need in the recording. Please use the chat for questions, or when the time comes after each section of the presentation, we'll stop and take Q&A. And for anybody who's on the phone, we'll make sure you have a chance to answer as well, even if your question is not in the chat, since you're on the phone. So we'll do that at the end of every section of a material that we have. And also, a couple of other reminders. If you need any support from Telligen for Qualitrack or for the cases that you're working on, here's the support center information. I put that in the chat. I'll do that as well as we go along. If you need something urgently, please call the support center. We have live agents there to answer your call and help you with anything that you need. If it's about an individual case, such as an RFI question, that sort of thing, they'll escalate it over to the operations team, to the reviewers and myself, and we will get back to you as quickly as we can to give you a response or gather more information from you so that we can give you a response. So please call during business hours if you have anything urgent. Otherwise, you can call or email, and tickets will be created, and we will take care of your questions for you. Okay? I'll be putting some resources into the chat as well. I want to put this primary resource in there right now. This is the page on the department's website where all the information and resources are stored for this contract. So please look there for information, including the write-up from the office hours sessions, the recordings, and the URUM provider user guide. That is really valuable in terms of understanding the reviews, what's needed for each review, et cetera. I'll put some of these other links in as we go along. And if anybody needs anything, you can reach me through the support center most easily, but you can also email me if you need to. If it's about a case or would require a ticket, my request is that anything about a case or Qualitrack, go to the support center. If you have other things that you need help with from me, you're welcome to email me, but this way we can track everything that people are asking about through our support center tickets. So I appreciate you doing that, unless it's specific to something that I need to answer for you. All right. I wanted to just look at our goals with you today. We're talking about how to assist you more with OCC, over cost containment. We're going to have the department talk about that a little bit. We're going to talk about in-home support services and the connection to long-term home health, as well as documentation to submit. And we're going to share the samples of documentation again that we shared with you once before. Hopefully that will be helpful to you. And then we also are going to speak about the supported living services exceptions reviews, as there's going to be a training coming up. So Karina is going to share some information about that with you. So that is our agenda for today. Of course, we have questions and answers, as I said, after every section. And then we'll have a general question and answer section at the end of our time together. All right, here we go. I'm going to start quick by turning this over to Karina. Karina, I hope you're here.
I am. I am.
Good. Hi, thanks, Karina.
Yeah,
Could
of
you
course.
please introduce the department's team?
Happy to do so. Hi, everyone. Karina Barrick with HICPAF. My pronouns are she, her, and I work with OCC. Wanted to introduce our HICPAF team. We have Danny Comstock, who works with CDOS. Danny is not here with us today, but Amanda Smith is, and Amanda works with IHSS. We'll do our best to answer all of your questions. And Kidron, who works with CES HCBS, is in here joining us today. But again, we'll do our best to answer anything that you have for us today. I'll pass it back over to you, Pam, for the Telligen team.
Thanks, Karina. Um, I put at the top of this list the support center. We have our support center team. They're not here with us today, but they are on duty and answering calls and emails. So they're there during regular business hours, and you can certainly get in touch with them. We have our lead reviewer, April Kelly. April had her camera on. You can wave, April, if you want. Julie Box is also our lead reviewer over CES, SLS, HBU, and ICF. Sorry, April focuses on CDOS, IHSS, and OCC. Julie also does some work in the HMA reviews as well. Unfortunately, Julie isn't with us today, but she is generally around most days. Today, she just wasn't feeling well, so we hope she feels better. And then we have our reviewers with us. Angie, Jasmine, Jennifer, Joy, and Susie are all here. And they're here to listen to what you have to say and answer any questions that you may have in areas that they're working in as well. So thank you, Karina, and thank you all team members from the department and Telligen for being here. All right, so just a couple of reminders. I spoke about this a little bit while people were coming in the room. If you're in a room with someone who did not register, please register for the session so we know who was in attendance here. And I put that link into the chat. If you weren't on the chat yet, I'm going to put it in again one more time. Here it is, registration link. I know the session is already started, but we do appreciate knowing who was here to be able to listen to us. And if we need to get back in touch with you to give you information on a question that you might ask, the registration helps us track you down and get back in touch with you. So please register even if you're with someone else. Also, again, please stay muted until we ask for questions, which we'll do in every section. And please ask questions at the end of each presentation topic for that topic. We will have a general Q&A session at the end, so you can ask about other things. So if we can just kind of keep the questions together for the topics that we are on, that would be great. Sorry, I'm a little tongue-tied today. My apologies. You can also add your questions to the chat, and we have chat monitors watching the chat so that we don't miss anything, and they'll guide us back to any questions that may have rolled up the chat while we were talking. So we'll get started here. I'm going to turn it back over to Karina to talk about overcost containment.
Thanks, Pam. Before I jump into OCC, I just wanted to thank everyone for being here, especially if you're a case manager. I know your schedules are busy, so thank you for taking the time to come and join us today. Just a reminder, as Pam said, questions, put them in the chat. We'll make sure to get to those. Diving into OCC, we wanted to provide some support for case managers specific to OCC reviews. One of the things that's been identified that may be helpful is how to tell when a case is OCC. And doing this before you submit a review with Telligen can save time on all ends. If only an IHSS review or only a CDOS review is completed, but then the case is OCC, the case manager will have to go back and get that OCC review. So what we really want to do is save everyone time and make sure we're eliminating any unnecessary extra work. So on the slide, you can see there are two examples here. These are two bridge shots, screenshots. So this is case managers, you've built the PAR, and this is a section on the bottom right-hand side of the bridge page above the tab sections. This is where it indicates to you the total average daily cost of services. If the total average daily cost is over $330 a day, it requires an overcost containment review. And typically, we're going to see cases that are overcost if there's HMA, long-term home health. So think IHSS, CDOS, long-term home health. The first example you can see on the right is that the cost of services and long-term home health, so you see the long-term home health average daily cost line, the combined cost of those two exceeds $330 a day. If you're only looking at the HCBS average daily cost, you're not getting that full picture because the 255 a day is for HCBS services. But again, OCC, we look at the full picture. So it's the full combined total average daily cost. The second example on the right, you can see the average daily cost of services exceeds $330 a day. This doesn't have long-term home health. This is just the average daily cost of services. And again, with something like this, we would be seeing HMA. I also wanted to address adjusting incorrect long-term home health average daily costs. So providing some direction on what to do if this average daily cost that's showing up in the bridge is incorrect. An example of this might be that the member has ended their long-term home health services, but the PAR is still showing the full cost for the full certification period. What would need to happen is the case manager would contact the long-term home health provider, confirm the end date, and then request that that provider contact Acentra with the change request to update this information. To ensure that members' PARs are not continually pending while we're kind of waiting for that update from Acentra, you can also send an email directly to the OCC inbox with this information, and we'll, rather than obtaining an OCC PAR or an OCC approval, if not correct, we'll approve that internally. That's all I had for OCC on this slide, Pam. I'll pass it back over.
Thanks, Karina. We'll take a quick break here for some questions. If there's any questions about OCC, I'm looking at the chat and don't see any, but if anybody has any questions, please take yourself off mute and ask your question. You can also type it in if you prefer. Any questions for Karina? Anything about OCC?
I'll also share, we'll talk a little bit more about long-term home health broadly. I just saw a question, Crystal. Yes, I can put the OCC inbox email in the chat.
Yes, I was just going to go grab it. Thank you.
Thanks, Pam. And I will be here for the rest of this training. So if something pops up with OCC, questions about OCC, let's chat. As mentioned, want to make sure that we're making this as clear and as easy for case managers to get approvals when needed.
Okay. Give me just 1 second here. Sorry, one of my screens popped away when I was trying to do this.
Do you see a question from Delaney, which is for the reg LTHH, since the home health agencies do their own and then send to UD, how do we deal with the OCC? So Delaney, we'll get a little bit more into long-term home health and reviews in general within this, but if you're looking specifically, if you're looking at the PAR, if we go back to the thanks, Pam, if we look at this OCC page, you should be able to identify from the PAR, because this is the long-term home health PAR under the long-term home health average daily cost. So that's what it comes from, is the long-term home health PAR. So you should be able to identify from the actual bridge PAR what the total average daily cost is, and if long-term home health will push it into an OCC threshold. Did that answer your question for OCC, Delaney?
Delaney, you're welcome to come off mute if you can and want to. For everybody who's listening or may not be able to see the chat, Karina posted the email box for the OCC area. It is ltssocc@state.co.us. Do you have a follow-up question, Delaney, that you'd like to ask?
Yes, I will. Can you hear me?
Yes.
Okay. My concern is when we have our HCBS clients and we have long-term home health going in, and they may be it might be over cost containment at that time. And since they're doing their own PARs now, and then they just send us basically the 485 and the little letter that says that they're approved. How do we manage to know, when they're over cost containment, how are we to manage that with our other services and all? Do we go through you, or does the home health agency go through you?
I'll share some information, and I know Paul's on here, so Paul, if you want to jump in with long-term home health processes specific, please feel free. So Delaney, the long-term home health agencies are sending their PARs to Essentra, which is a vendor with the department, who then inputs the specific long-term home health PAR for each member, and that's what feeds into the bridge. So the cost of that long-term home health PAR that is being developed feeds into the bridge and then comes into that long-term home health average daily cost line. So as you're building the PAR, that is where you should be seeing the long-term home health average daily cost. Perfect. Thanks for highlighting, Pam. Delaney, that also being said, I know we'll get into a little bit more about what information case managers are actually receiving and how that connects with HMA and reviews just in general. But did that answer your question as far as knowing the cost for services when it comes to long-term home health?
Oh, fairly well. But our thing is we do our assessments 3 months out, and we try and get our PARs done 30 days before services start. And our home health agencies usually don't do their PAR until due date. So does that come over later when we've already built our PAR?
That's a great question. I'm actually not sure the timing on home health agencies prior to CERT period. Does anyone else from the department have an answer to when that would be input?
Hi, everyone. It's Amanda Smith here at the department. I will take a whack at it, Karina, because I think there's a couple of factors that may come into play. Rather, if it's acute, are we looking at, is this a long-term home health PAR that's going for an entire CERT period? So I think there's a couple different factors, but I think I'm hearing what you're saying, Delaney, as far as, hey, I put in this PAR, an agency gets their PAR submitted to a Trezzo, and then I come back to that part. Now it's OCC and I need to submit to Telligen. We're not sure if those services um, would be approved or not.
And Amanda, I can tell you that we will see the cycles not match up. It depends on when long-term home health started, or if it ended at some point, or it's different with every person. So from Telligen's point of view, we know that they don't always match up. And what I would say is, if you have done a review, like for IHSS, an HMA review, or CDOT, or not, well, whatever, for IHSS, sorry. And then long-term home health comes around with a new PAR in the year, and it's over cost containment, and there hasn't been an over cost containment review, that would be the time to submit just an over cost containment review. And it would, we would look at it as additive to that, and the department would have to do their part, once it's completed, which Karina can speak to. But from our point of view, whenever anything changes or anything's added, that's the time to add a new review.
Thanks, Pam. And I also just want to mention, I know that in our next couple of slides here, we do have our long-term home health policy advisor on the call. So we are going to talk a little bit more, at least from the long-term home health point of view, just to have a little level setting so we can all kind of understand how this process is working going forward.
And I see some questions coming in about that and some comments about that. So hold on to that for just a second. We're going to come up to a larger discussion on long-term home health. So we'll get there. Our intent was to just review some items for LTHH, if that works for everybody.
Okay. Thank you.
You bet. Is there anything else about OCC that anybody wants to ask about? Okay. And when we get to the long-term home health, just, for those of you that have put in a couple of questions, if for some reason we're not answering your question fully, just let us know when we get to the Q&A part. Okay. All right. Karina, anything else from you on OCC?
I'm good. Thanks, Pam.
All righty. I'm going to move on here to IHSS and just talk about the documents. I think all of you have probably heard us talk about this at other office hours or in the recordings, or if you've looked at the resources, we talk about these quite a bit. These are the required documents for IHSS. So we're looking to make sure that the 100.2 is complete, the IADLs, and any other documentation that outlines the members' needs for IHSS. We access the 100.2, we meaning Telligen, and the IADLs in CCM. So you do not have to submit that. If you'd like to download it and submit it, you're welcome to do that, but we look those up. For any case that might be OCC or is submitted as OCC, um, we are asking for the appropriate information on that, anything for OCC. And if we suspect it's OCC, we'll go look at the PAR. So the department has asked through this contract that the PAR be created and saved, but not finalized prior to you submitting a review to Telligen so that we can see what your plans are. Understanding that we have a conversation going on about long-term home health, and that contributes to the OCC costs. So we'll come back to that here in a minute when we talk about long-term home health. I just wanted to remind you to make sure that all the parts and pieces that have to be done in CCM or the bridge are done when you submit. Okay. We also need to see an IHSS care plan calculator with each case. If for some reason anything changes in the case through the review process, please be sure and submit an updated care plan calculator. And if you've made changes to something that we've already approved during a reconsideration or any of those kinds of processes later on, please tell us that you are making a change or you want to change something in the calculator. And you can do that by adding a note to the case or submitting just a Word document that says, I needed to change this or that in the calculator. It just helps us track what you're doing, and we appreciate that a lot. We also need the agency care plan. The agency and the case manager should be working together to develop what is needed by this individual. And the agency care plan should reflect that along with the hours and frequency or minutes, units needed by the individual. And that should correlate to what's in the care plan calculator. So if you're getting an RFI from us saying they don't match, the issue is there's something in the care plan that doesn't match what's in the calculator or vice versa. And we do need them to match. So we're unclear as to what the services are expected to be when they don't match. So that's something that the case manager can really pay attention to that would help avoid RFIs. We also need the long-term home health PAR and agency care plan. And if PDN is involved, we need the PDN plan of care. I'm going to stop sharing here and bring up the documents that we want to show with you. But while I'm doing that, April, do you have anything to add to this? I have other little tips on there, including the optional documents. So IHSS exercise plan, medical records or service plans, medication lists, et cetera, that can be helpful. Do you
Yeah,
want to?
I was just going to mention, we have been seeing quite a bit of cases come through where tasks are being requested on the calculator or the task worksheet, but the 100.2 and IADLs in CCM are not reflecting what you're asking for as far as time on those calculators. So I would just throw it out there. I know Pam mentioned it on that first bullet point. Just make sure that the time that you're requesting is justified in your documentation. Sometimes we do see documentation from the IHSS agencies uploaded, but we cannot solely use that alone for the justification that we're seeking. So we do need to see at least the need as present in the CMA documentation. Most of the time that can be found in your CCM documentation, but a lot of the times case managers will just add a Word document with very specific information that is needed for the Telligen review. So I just wanted to throw that out there. We have been seeing an increase in maybe the 100.2 being copied over from the previous year without updates, or maybe there's not even an updated one in there. So just wanted to let y'all know about that.
Thanks, April. I'm going to share some documents that we shared at last May in 2024 at our office hours there. These are de-identified documents, and this is available to you on the HCPF website. I'll put that into the chat once again. So we went through this entire process here of going over the documents and the examples. It gives you a lot of reason and information for each of the categories. But what I'm going to do today is take you down to the actual documents so that you can just see what it is that we're talking about. And April, do you want to point out anything on the PAR here while I'm here?
Yep. I'm not sure if you're sharing it yet, Pam. I can't see it.
Oh, my apologies. There you go. Sorry about that. There you go. So let
Okay.
me just redo this. Up above here is information that we have for you on specifics about it. But today we really wanted to just make sure we were focused on the documents that we need, and we're talking about how this relates to long-term home health. So, but this is all available on the HCPF website. Okay, April, thanks.
Yep. So when a member has long-term home health, this is what's called the long-term home health PAR. This, from what we've been told, and it looks like we'll be talking about this here in a minute from a representative from HCPF, but what we're being told is you guys are no longer receiving this specific form from the long-term home health agencies. Some of you are still getting it, some of you are not still getting it. But when we reference long-term home health PAR, this is what we're referencing. And the main things that we're looking for on this specific document is the frequency, the units, and then what's important and for the OCC part that helps us calculate if a case is OCC, maybe if they haven't yet quite put it over into the bridge yet. If you look at line 17, which says total requested adult long-term care health expenditures, that is the total amount yearly that the long-term home health is being paid. So we can calculate a daily cost based on that amount. So that's super helpful to us and it could be helpful to you as well if you're able to get a hold of this form to really determine whether or not a case is OCC. So this is one of the forms we receive for long-term home health. Pam is going to show another example of something that we've been receiving. We'll get to the 485 in just a second. Can you go to
Can
that
you see that?
Yep, this one.
Okay.
So for those of you that aren't getting the long-term home health PARs from the agency, this is the other thing that we're seeing. Karina or Amanda, I'm assuming this is a printout from, I'm assuming the bridge. I don't know exactly. And it has your Cigna up at the top. So I'm not sure exactly where this is coming from. I don't know if you want to chime in real quick. Either of you? Okay. Or maybe
Not
your long-term home health representative can let us know where this is coming from too. But this is great for us as well if you're not getting the long-term home health PAR. Pam, if you want to scroll down just a little bit, what we're really looking for here is the units and the code. So the code is telling us what the service is, whether it's going to be a nurse, an extended nurse, sorry, not extended years, an uncomplicated visit 1 or 2, and it'll tell us if there's a CNA involved and if there's extended units. So we won't know. Sometimes the 485 doesn't tell us what the service is or what the code is. So this is really helpful. And the 485 also does not give us units. So when we're approving the long-term home health or putting it in the outcomes letter, we have to have the units. So this form is really helpful. Like I said, if you're not getting that long-term home health PAR. And I'll pause here in case anybody wants to chime in to say where this form is coming from. If not, then we can come back to it. Okay, so we'll come back to that. And then we'll scroll back up, Pam, to the 485. All right,
Am I
so
here?
this is the long-term home health 485, and what this is a care plan from the agency. So everybody should be getting this. Everyone should have access to this. And what this tells us is all of the specific tasks that are being done by the long-term home health, whether that be the skilled nurse or the CNA. And usually from most of the agencies, there's a very specific breakdown. So if a CNA is coming in 3 to 4 times a day, there'll be a breakdown of each visit. And the visit 1 is a bath, a dressing, skin care, hygiene. All the things will be listed here. And why we need that is because if you're also requesting PCP or relative PCP or homemaker, this gives us an indication whether or not there's any duplication of tasks. So we also rely on you to spell that out for us in your CCM documentation on kind of who's doing what when, because that will eliminate a lot of RFIs if you can tell us who's doing what when. For example, if a CNA is coming in 2 times a day and doing bathing, but you are also requesting bathing from a PCP, we would ask, why is a bath needed 3 times a day? Because we're seeing it being requested in different areas. So that will be extremely helpful to us because the 485 doesn't tell us what the PCP is doing. It's just telling us what the skilled nurse or the CNA is doing. But this is always what it looks like. It very rarely veers off from this. So this should be included every single time somebody has long-term home health. This should be a document uploaded to Qualitrack for us. So I'll pause there to see if anybody has any questions regarding the long-term home health PAR or the 485.
And you can see that this form is long, multiple pages in this particular case.
I'll also say too that some agencies, I'm not sure why, but they'll say something very generic like CNA is assisting with ADLs, and it'll just say that. So then we'll RFI back to you and say we need to have specifics on, what the CNA is doing. What specific ADLs is the CNA assisting with? So if that's the case, you could ask the member. You could go back to the long-term home health agency and ask them. Sometimes they'll provide an addendum to this 485 and we'll see those. And then sometimes we'll just see documentation from you on what the CNA is doing in the home.
Okay. I'm gonna stop here, April, if you're done. Okay. And I'm going to just go back to our agenda. We're going to take questions here in just a minute. We have one more thing that we want to talk about before we take those questions. So all of you can see that next slide, right? In-home support services samples, that's where we are, and the LTHH process. So part of what was suggested to be covered today included the LTHH process and may answer some of the questions that we're seeing pop up in the chat. And Paul, are you here?
Yeah, I am.
Great. So Paul, welcome to our meeting today. Paul is with the department and is here to talk with you about the long-term home health process.
Good afternoon, everyone. So I don't have anything relatively prepared. I jumped on this meeting here at the last second. Just want to give you some quick overviews of what's going on with adult long-term home health and how the PARs are being processed. Memo went out back in October where the process was changed mainly to streamline what was going on between CMAs, long-term home health agencies, and Essentra, who is our vendor. So as of mid-October, I believe it was October 14th, long-term home health agencies are now sending their PARs to Essentra directly. Those are getting processed and hopefully approved. That's kind of the big hope there. Anything before October 14th, the case managers were doing the PARs and then sending them to our long-term home health PAR inbox, which were then getting processed by the departments. That process was slow and laborious and just didn't make sense. So that's why we made the big change. I'll post some links here after I'm done talking with those memos. And also there's a really good Q&A or an FAQ page on the long-term home health website that gives answers to a lot of these questions and provides a little more detail to the process of what's going on. I was really brought onto this meeting to talk about what's going on. There's a lot of confusion, especially in the last few weeks, about who's in charge of inundating PARs, changing PARs, kind of with this whole big change. So really anything after October 14th, and I don't know if you guys, I don't see what you have on your side, but if you have a PAR that starts with a number 9, those PARs need to be inundated. Anything that needs to be done, any type of revision needs to be done by the home care agency and submitted to a Trezzo. You guys should have nothing to do with those. If you're getting a request to indate a PAR because of like HCBS services, anything like that, that process needs to be initiated and taken care of by the home care agency. If you guys run into trouble, the home care agency is not responding, if they're refusing to do so, please let us know. And either myself or Christine Merriman, we run the home health inbox. We can use our mom and dad voice and get a hold of these providers and make sure they are following the process. If a PAR needs to be inundated or something needs to be changed and the PAR starts with the number 6, that means it was processed by our department and that should be taken care of. You guys can just send us an email. I will then turn that around and send it to the long-term home health PAR inbox and get that taken care of for you. And again, I'll provide links to the home health inbox, the memo series, as well as the FAQ page in the chat here. But really what we're trying to do, I've got a question here. So if it was approved for CDOS and you can't submit, so meaning if the dates are overlapping or if there's still an open long-term home health PAR?
So they just approved it and we had no idea they approved long-term home health. So we didn't approve it. I'm assuming Centra approved it. Now we can't submit the parks. We get an error that long-term home health was added. And I I sent this to the home health email box yesterday too to look at it. What do we do? Because we weren't aware of it and now it's a problem.
Yeah, no, we actually got your, and I think Christine responded to you. It's myself and Christine who are looking at that inbox. We were not able to open up your secure message. I think she responded that she was going to send you an email saying we couldn't read it.
Oh, okay. I sent her because I sent 2 emails, so I'll resend that one. I sent her the information regarding the first one, but I'll resend this.
Okay, perfect. Yeah, and the case, and that's, I personally don't know what to do if you guys were already in and then long-term home health has started and now you guys can't submit a PAR. That would be a great, again, you did the right thing by sending to the inbox and we can outsource that and get to the bottom of that problem. But it really requires care coordination, and that's specifically in our rules that the long-term home health company needs to be getting a hold of the CMAs and providing them with the 45 and with the long-term home health PAR. They need to do that as part of the care coordination that is in our, again, that's in our rules and regulations. If you are having trouble with a home care company that is not doing that and not being forthcoming with that information, again, please let us know and we will resolve that issue for you. We've had a lot of requests come in asking, who is the long-term health provider? The member doesn't know, they can't get a hold of us. Please, again, let us know. I'm happy to look up that information for you and provide any insight that I can. But that's a very high level overview of what's going on with adult long-term home health PARs. If you want to get into pediatrics, that's a whole nother meeting we can get into, but that's just for adults currently. And thank you for posting that, Amanda. And then you can see the home health at state.co.us. That's the email address to get a hold of us.
Paul, it looks like you addressed some of the questions that came into the chat prior to that regarding long-term home health, from a couple of people saying that they were not getting PARs, etc. And I heard you suggest that they let you know
Yes.
if they're not getting them. So if anyone has follow-up to, why don't we just pause here? We'll take the questions now while Paul is here, because that appears to be a big part of what is on people's minds. So Paul, if you can stay for questions, and for those of you who put anything in the chat, if Paul didn't answer your question, please come off mute and see if there's any more information or anything that he can relate to you about what you wanted to know.
Yep, and I just put in the long-term home health websites. If you go to that and scroll down to the bottom, under additional resources, there is a Q&A document that talks about the whole process, as well as a link to the operational memo. What else was I going to say? There's something else. Yeah, but anyways, go there. And again, if you guys have any questions or concerns, please email us. Christine and I try really, really hard to make sure all of those comments, suggestions, inquiries are all answered within 24 hours.
Okay, we'll take a pause and see if anybody has additional questions or anybody asked a question in the chat that had to do with long-term home health while Paul is here, and see if he can help. So come on off mute and ask your question.
And then one quick follow-up. I've already drafted a memo, started last week. It's in the clearance process. So look for a memo coming out next week, which is again going to clarify this, specifically targeted to long-term home health providers and CMAs, just to kind of further this education and further this process that home care agencies are also responsible for the care coordination as well, and they need to be doing their part.
Okay, thank you, Paul. Any questions from anybody? Follow-ups from the chat questions? Take a second and pause here. Okay. Anybody on the phone who wants to ask a question about this? Okay, it looks like you're off the hook, Paul. All right, we'll keep going with the rest of our content now. Thank you, Paul. We appreciate you being here. We put some questions in here that we get about IHSS. Some of it was just covered by Paul and by our other slides, but I wanted to just keep these in here. Make sure that if anybody has these questions on their mind, you have clear answers today. First one, can a member have IHSS and LTHH? Yes, they can. And what about IHSS and PDN? Yes, they can. That's all part of the process. For Telligen's part, if we're doing a review for IHSS, just be sure and let us know that they have LTHH, provide the care plan, the 485, and the PAR information or alternative PAR, as April reviewed. And same with IHSS and PDN. Just be sure we have that information. Make sure we get the PDN care plan for that. April, please chime in if there's anything I miss on these questions. Okay. What documentation is needed? We reviewed the documentation a couple slides ago. I'll just jump back there. Here it is. The 100.2 and ideals need to be completed in CCM. We need the IHSS care plan calculator, the agency care plan, and anything having to do with LTHH and PDN. Okay.
And I'll just chime in real quick, Pam.
Go ahead.
One thing I wanted to add is sometimes we'll see a child's case and or an OCC case where there are a lot of different services being coming into the member's home. So it could be long-term home health, could be PCP, could be relative PCP, could be PDN, all the things could be going in. So what is very, very helpful and will also avoid quite a few RFIs is if you provide us a schedule of who's coming in when. This also applies for if somebody has adult day program. So sometimes we'll see, a CNA is coming in 3 times a day, and you are also requesting 40 hours of PCP, and the member is attending adult day program. It's us, because we don't know this member, so it's hard for us to wrap our head around how all of this is being done in one day unless we see like a broken out schedule. Like the PCP comes in from 7 to 8, then the person goes to adult day program, a schedule like that. And then very specifically, we see the most hours with long-term home health and PDN. So that is very, very helpful. PDN agencies should have a schedule, and you can request that from the agency. So that should be accompanying your reviews when you submit those to us, especially when there's a lot of care going on. If it doesn't make sense to us, our main goal is to avoid duplication. That's what we're looking for in these reviews. So if it doesn't make sense to us, we're going to send it back to you for more information. So just wanted to throw that out there.
Thanks, April. And I will add that when you do the schedule, just indicate what the person is doing. So if um, the PCP is coming in to help the person get out of bed, to help them get dressed, to have breakfast and move on and get them over to their day program. Um, and they are taking a bath in the morning, let us know that. So it can be a brief list of what they're doing, but if you tell us what they're doing, then we have a much better understanding of that. And one of the things that April spoke about before is the description of what they're doing, the need of the person in the description. And all of you who may have put in a ticket that I've answered or talked to me on the phone when you have a question, I always ask for this, which is the description of what they're doing, how often they need it, and for how long each time. And that's, on average, because we know one day it may take a little longer, one day it may be a little bit shorter. But that's what we're asking for. That's what the calculator reflects. That's what the CDAS task worksheet reflects is what's the person's need? We know from what you've documented in the 100.2, what's the caregiver doing, a short description, how long and how often. And those are the things that tell us what's going on. So in relationship to this, if they have more than one service, we just need to know who's doing what, where, and when, and how long it takes. We've seen this in spreadsheets sometimes when it's complicated. Sometimes the family will do that just for their own use. That can be really useful for us. We've seen it in a Word document where it's just narrative, or within a table in a Word document, all of that. So it doesn't have to be in a particular form as long as it includes all that information. All right, back to the questions. April, anything else on that? Okay. We just talked again about what documentation is needed, a little bit in detail. Number 3, what if the LTHH PDN agency doesn't provide the documents? I think Paul helped with that regarding the LTHH. You can email them. If Paul or Karina, Amanda, if it's a PDN agency, I'm assuming that it's a long-term home health doing PDN services. Am I incorrect about that? Can somebody correct me for what I don't know about PDN?
You're correct.
Okay, so if it has to do with that, then they would still be able to email the long-term home health email box if they need something, correct?
Yep, that's correct. And this is Christine Merriman. I'm the private duty nursing policy specialist. I jumped on after you already started, so
Great.
I'm here
Thank
to
you,
answer
Christine.
questions if you need.
Awesome. Thank you so much. I appreciate that. And for giving me something new to learn today. I appreciate that. Thank you. All right, so use that email box that Paul posted for anything long-term home health PDN related. What information will help avoid an RFI when a member has both IHSS and LTHH? And actually, that's what we've really been focused on here today is the issue of potential duplication. You just need to let us know what's going on where and when and make sure you're clear about that, especially since the long-term home health is coming from an agency and your IHSS may be coming from an agency. So you're coordinating things for that person. So your view of what's happening for that person as each caregiver comes in, what services they're delivering, I'm sure it would be clear for you just like it would be clear for us. So that is really the best thing we can ask for is some kind of a schedule and the clarity of what's going on for that member, not just what their needs are, but what's happening with all their caregiving. April, do you have anything else to add to that one?
Nope.
Okay.
Thanks,
All right.
Pam.
Thank you. All right. I asked what else here because this leads us into our Q&A about long-term home health and IHSS. Sorry, I added an extra S. Sorry about that. IHSS. All right. So I'm going to pause here and open it up for questions. If anything has occurred to you about long-term home health, Christine and Paul can help answer that. We can help answer anything for IHSS from Telligen or from the department with Amanda here and Karina here. So we'll just stop and open up the lines if anybody has questions, comments, concerns. Now's the time. Please don't talk about any one individual during this session, if you could, please, because it's being recorded. You can speak in general terms if you need to about an individual, but please don't use any PHI. No questions? No follow-ups? I know some of the questions in here have been answered. Make sure that everybody has that. Yes, this will all be posted on the department site. Some clarification on what Telligen reviews for. Thank you, Jasmine. Anything else from anybody? If not, we'll move on. Okay, Laura wanted to clarify that the rule still stands that members cannot have both LTHH and CDAS, correct? That is correct to my knowledge. Department, anything else that I don't know?
You're spot on, Pam. It is
Thank you.
correct. Yeah.
Yeah, what I remind myself of when I think about this is the logic of this, right? CDOS is all about the member managing their care, right? It is the situation where the member has the most input. They control, they manage, they hire, they do everything about their care. Whereas, and so therefore no agency is involved. Whereas on the IHSS side, their long-term home health is available. There's an IHS agency who coordinates and trains the caregivers, et cetera. Long-term home health is similar. Many of these agencies are both long-term home health and IHSS agencies as well. So it's a different delivery model, and people have preferences about that. Whereas in IHSS, you can have family caregiving. They don't have to be employed by the long-term home health agency as an employee, et cetera. So from a member's point of view, there are differences in the delivery. So just thought I'd offer that as my reasoning, my understanding, and how I think about these programs. If anybody has anything to add from the department or Telligen, please jump in. Okay. All right, then we'll move on. So thanks everybody for a good discussion and good questions here. And thanks to Christine and Paul for joining us for the long-term home health discussion. We appreciate it. Our next topic is supported living services exception reviews. And Karina is going to take that. I'll turn it over to you.
Thanks, Pam. So we have a new SLS exceptions training that will be coming out sometime this month in February. It will be a web-based training that is published on the SLS exceptions website. Along with that, we're going to have a new form. And so the request is whenever you're doing an SLS exception, go ahead and go straight to the SLS exceptions website to grab that form rather than downloading, just to make sure you're using the most updated form. There aren't major changes on this form, but again, that will be demonstrated in the training. The ask is that if you're a case manager who's working with SLS exceptions, you go through that training, whether it's through the recorded presentation or through the slide deck, to be able to get the whole picture on what the process is and what is needed for the review process through the form. Any questions on SLS exceptions? We will plan on giving a shout out to folks when that is available, so keep an eye out for that. And if there are questions, please feel free to ask at any time.
Thank you, Karina. So we will send out an email blast when the training information is available to help get it out to you so that you'll know about that. I also put the link in to the form into the chat if you need it. There's a question from Jennifer on a case. Karina, can you see that
I can. I'm going to go ahead and go through this. So first part, I
Okay.
received a clinical denial for an SLS exception. I am not sure what to put for what is the imminent risk for seeking emergency enrollment on the developmental DD waiver. The family was told by another CMA to switch from DD to SLS, and now she has moved to her own apartment and financial cannot afford all of her bills. Jennifer, I can also put my email in the chat if you want to talk really specifically about cases. I can be able to talk in a little bit more detail through that format. To answer the first question is what is the imminent risk for seeking the emergency DD enrollment? SLS exceptions are approved under that guideline, under that broad guideline. So a member must be at imminent risk for an emergency de-enrollment in order to access those services over the SPAL. That's per regulatory, and that was kind of part of the original legislation for this piece. So that is the foundation of any SLS exceptions request. And on the second question, which is, on the requested increase amount to SPAL, include dollar amount. Do I include the dollar amount difference from the current SPAL to the proposed SPAL? So requested increase to SPAL, that is basically the amount above and beyond the SPAL that you're requesting. So it would be, if you look at it, if you built it in the bridge, it would be the total cost minus the SPAL. Does that answer your questions? I'm going to go ahead and put my email in the chat as mentioned.
Jennifer, do you have any follow-up? Okay, and Karina, there you go. Thank you. Thanks, Jennifer. You'll email Karina, and Karina, thank you for posting your email for Jennifer to reach out to you. All right, any other questions on SLS for the moment? Okay, we'll go on. We have some reminders for you as we were putting this session together for today. The reviewers came up with a few reminders that they wanted to just share with you. April, I don't know if you knew I was going to call on you, but would you mind sharing the HMA reminders?
Yes. So this is basically just to avoid RFIs, get this stuff together for us in the first go around, and it'll save a lot of time for everybody. So we mentioned before, when you're submitting cases to us, that your documentation or the need for the member to have specific services that you're requesting needs to be present in your documentation, specifically from the case management agency. We need to see it in the CMA, CCM, and or some piece of uploaded document from you into Qualitrack. So we need a description of the member's need, the reason why the service is being requested. Sometimes diagnoses are very helpful. This is a good plug for diagnoses, actually. Within Qualitrack, Qualitrack actually only requires one diagnosis to be entered when you're submitting a case. We have seen a lot of diagnoses being entered. I'm not saying that's a bad thing. We love to see that. It's helpful for us, but you do not have to do that. We are able to get into the CCM and see diagnoses within that, as well as medications if they've been entered. So I just wanted to throw that out there, maybe to save you guys a little bit of time. But diagnoses do help us, depending on some of the different HMA areas that you're requesting. A specific diagnosis doesn't always mean that a task is skilled, but if you're giving it to us, it does help out. So if you're requesting skilled nail care and you're letting us know that this person has skilled nail care for toes, and you're letting us know that this person has diabetes, that's very helpful information. So the more information you give us, the less RFIs you're going to get. If you're requesting 30 minutes for a bath for this member, we just want to see who's doing the bath, why the bath is needed, if it's an HMA task, why it's a skilled task, and that 30 minutes is making sense. If you're going to be requesting over the norm, that's another good plug in here for time norms. When you're looking at your HMA task worksheet, sorry, not HMA, your IHSS task worksheet, sorry, There's a couple,
Care
there's two
plan
of them.
calculator. Yeah.
Yep, your IHSS calculator or your CDAS task worksheet. Each of them have norms listed. Most of them, some of them are independent based on the member, but most of them do have a Medicaid time norm. So when we go back to the example of bathing, if you're requesting over the 30 minutes for bathing, we need to see in your documentation why you're requesting that time. So if you're going to tell us that maybe the member has some behavioral issues, or maybe this member is in a lot of pain and having some issues with moving around, that's going to give us an idea of why you're asking for the time that you're asking for. So the more information you give us, the better. Again, we kind of chatted about a description of what the caregiver is doing, including hands-on assistance for HMA. So if you are requesting HMA tasks, for example, in bathing, for you to tell us just that the member needs hands-on assistance in bathing isn't enough for that to be a skilled task, for us to realize that's a skilled task. You'd have to give us a little bit more information for us to know what makes that skilled. So another really, really helpful document, which I'm hoping somebody will put in the chat, is the HMA documentation guide. So if you don't know what this is, I would get very familiar with it, because this is what we use when we're looking to see what makes a task skilled or not. So in the example of bathing, maybe the person needs a skilled transfer. Maybe the person has a wound. For whatever the reason is, those reasons are listed in that HMA documentation guide. So if you are requesting skilled care, we will need to know what makes that task skilled. Also, how often the service is needed. So like I said, if you're going to be requesting a certain amount of time, we need to know in your documentation why that time is being requested. It's very helpful for us, and it's going to reduce a lot of your RFIs. And again, we just kind of talked about how long the service lasts. If it's going to be over a time norm, and I'm not just talking about bathing too, if the case is over cost containment, we are also looking at PCP and homemaker tasks. So if the tasks are going to be over the time norm, we do ask that you tell us why, in your documentation, why and why it's lasting longer. So if a person, I like to use the dusting example for homemaker. The Medicaid time norm for dusting is 35 minutes a week. So if you were going to be requesting more time, we would want to know why. So maybe this person has allergies and dusting needs to be done more often. We're looking for that information. So I think that's the main reasons. Probably the biggest reasons why we're seeing a lot of RFIs is we're just not seeing that documentation that we need to justify the time that's being requested. So if there's any questions on any of that, or anything to make it a little bit easier, or any tips, anybody can come off mute or ask in the chat. We'd be happy to give any advice or answer any questions regarding this.
I want to chime in on one thing you said, April, while people are doing that, which is about the diagnoses, because that's kind of a fine line at times, right? A diagnosis is helpful, but it's not all that we need. And April said that at the very beginning of what she said. If you just tell us they're paraplegic, it doesn't tell us everything that we need. We need to know what they can do and what they can't do. And for anybody, if you think about it this way, if many people have known someone who's paraplegic, paraplegia can be caused by different circumstances, different illnesses, different diagnoses. So what we're looking for is their capacity. We're looking for what they cannot do, what they could do, all of that. So the diagnosis is always helpful, but in and of itself, it's usually not enough. And sometimes it still makes a really big difference to know, like in the case that April mentioned, the nail care and the diabetes. Okay, any questions? I put the link in to the HMA documentation guide that April mentioned. Okay. I'll talk a little bit about just the CES and SLS. Julie, our lead on those cases, types of reviews. sent me this. Be sure the CES application is signed and dated. It's something we see pretty often. We wind up sending out an RFI for that. We could definitely avoid RFIs if the case manager ensures that the application is signed and dated, and we need both. So it should be signed and dated by a parent and completed in cooperation with the case manager. So that is the big thing for CES. Any questions about any of our reminders? Anything else that we need? Anybody need to come off mute and ask a question? Okay. We are at the end of our presentation and information. We have the rest of our time here dedicated to Q&A for you. We'll take any questions in chat, any of the chat monitors. Did we miss addressing anything that came up in chat? I think Jasmine's looking. And our other team members in the department team, anybody miss any questions? Please flag us now.
I'm not seeing that we missed anything, Pam.
Okay, good.
It's
Thank
looking
you.
pretty good. Yeah.
All right, excellent. So we will just open the lines here for any questions that you have. Anything else that you would like to talk about today? We have just under 25 minutes for questions. So you all have the floor. If there's anything you'd like to ask, anything that you need from us. Go ahead and come off mute. Type if you want to type in chat. Or if you're on the phone, you can just come off mute and speak into the session. Okay. If there's no questions, we'll go ahead and end the meeting. We'll stay here for a few more minutes in case anybody comes up with something or had any trouble coming off mute. Thank you again for coming. Hope your 2025 is off to a good start. We appreciate you being here. I'm going to put the support center information into the chat once again. And if there's anything else that occurs, we'll stay here for another handful of minutes and try to assist. Thanks, everybody. Take care and thank you for being here.
Hey, Pam, this is Kayla Kyle.
Hi, Kayla.
Hey, I was on another meeting, so I apologize. I missed the first 15 minutes. Are you guys going to will you send out your PowerPoint or how can I get that information?
Yeah, we have the PowerPoint ready to go. It just has to be cleared by the department and posted. It'll be posted on their website. And also we do a write-up of each session, Kayla. And so any information that isn't already in that write-up will be added. So just so you know, it's kind of an iterative document. We don't repeat everything multiple times. We try to just add anything new that isn't already in that document. So that will also be posted.
All right, perfect.
Okay,
That's all I
and if
needed. Thank you
there's,
so much.
sure, if there's anything you need, if you have questions about, you can reach out to me or put in a ticket and I'll get back to you.
Sounds good. Thanks so much. Have a good
Sure.
day.
Thanks, Amanda, for posting the address. Thanks, Kayla.
Yeah, thank you guys.
Hi, Pam. This is Meadow.
Hi, Meadow.
I have a question in regard to the CES application. When we change and it's not required during the 100.2 and we can do the CES application at a later date, what that looks like for start and end dates and possible RFIs.
I'm not sure I understand the question. Can you say it again, Meadow? It's in relationship to when you do the 100.2?
Yeah, the 100.2, that date that we put in starts the
So for an initial application to the waiver?
correct. Yeah. But I heard that in the future, the CES application, we have the possibility of doing at a later date. So it's not due on the same time. And the start and end dates will be different from when we do the initial assessment to when we do the CES application.
So you're speaking about the certification start and end dates.
Correct.
Okay.
Like, which one would we put into Telligen and not have it RFI?
That's a good question. I hadn't heard anything about a change in timing, so I can't speak to that. I'm not sure if anyone at the department that's on knows about that. Can I pause for a second and see if someone's here who could speak to changing that process?
I'm not aware of anything, Pam, but we can take that back to
Yeah,
Kindred
yeah.
and get an answer for that and include that in our Q&A when it's published. Thanks for
Yeah.
asking that.
Thanks, Karina. So Meadow, we don't have a specific answer for you. I'm sorry.
No,
But
that's okay.
did you register for the session, Meadow,
Yes, I did.
today? Okay,
Yeah.
so I'll make sure I'm going to make a note right now to also send an email to you directly once we get an answer about that. Okay?
Thank you, Pam. And it may be correct information, it may be not. Thank you so much for the clarification that you're getting
Sure,
at
sure. What's your agency, Meadow?
Rocky Mountain Health Plans.
Okay. CES. Okay. Any other questions from anybody? Okay. All right. I'll stay on for another couple minutes in case anything comes up, but thank you all for attending again. We appreciate it. And we'll see you again in May. Looks like people are starting to leave. I don't see anything else, but I'll still hang around in case anything comes up or any questions. Thanks, department team. We appreciate your participation and collaboration on this.
Likewise. Thank you all. Appreciate you.
All right, we're down to mostly our teams and a few other people. Genevieve, Christina, Aisha, any questions from you? Kelsey, Lydia, and Rosita. Nicole. All right. I think we'll call it a day. Thank you all for being here. I greatly appreciate it. Have a good rest of your Thursday and your pre-weekend day tomorrow. Take care, everybody, and stay warm.
Bye, everyone. Thank you.
Bye.
Thanks, Pam.
Thank you all.